Well, good morning, everyone. Welcome.
Good morning.
Welcome.
So I think it's the top of the hour. We want to spend the time wisely this morning. Am I sounding all right, Neosha and Emily? Okay, good. Well, let's get started. We have over 100 people joining us this morning, and I think I just was looking at the count. We're about 60 to 70 right now. So we'll get going. Well, good morning and welcome. And for those of you who don't know me, I'm Amelia Bond, President and CEO of the St. Louis Community Foundation. Thank you for joining us for our year-end donor event, Philanthropy and Pandemics, the Nexus of Health and Equity. I think it's a little bit topical given where we are this year. We are honored to have such an esteemed panel of experts with us today to share their thoughts and opinions on health equity during these unprecedented times. While we may start with a little bit of conversation on COVID, our hope is that it'll be a very broad conversation and you'll get a sense of their deep understanding of the topic and learn something today. We are also excited to have Ellen Sherberg, Special Advisor to the CEO of American City Business Journals, a St. Louis Community Foundation board member, and a longtime donor with the St. Louis Community Foundation. She's going to serve as our moderator. Today's panelists are Helene Gale, President and CEO of the Chicago Community Trust. Helene, welcome. Bob Hughes, President and CEO of the Missouri Foundation for Health. Bethany Johnson-Javois, Chief Executive Officer of St. Louis Integrated Health Network. And finally, Kiana Thomason, President and CEO of Health Forward Foundation out of Kansas City. We'll try to get to as many questions as time permits towards the end. We are going to end promptly at 10:15. Please use the chat feature if you have any technical issues, comments, questions, concerns. We will be monitoring those closely. Just want to make sure everyone is aware we are going to record this conversation so that we'll be able to have it available on our website for those who could not attend today. We wanted to mention one tip that you might want to place your view on speaker view so that you can see our speakers as they talk. We are hoping that we'll just end up in a place where they're having a conversation. We'll see how, you never know with Zoom. So at this time, I will turn the program over to Ellen Sherberg.
Thanks, Amelia. It's such an incredible honor for me to be moderating this panel. And clearly, this program was not created to focus on the COVID pandemic, but many of your questions have been directed to what we're going through now. And it would be disingenuous to ignore what's happening. It's more than happenstance that Dr. Helene Gale is with us. And Dr. Gale has played such an important role in addressing the pandemic and more particularly the vaccine. She has served as co-chair of the Committee on Equitable Allocations for the Novel Coronavirus for the National Academy of Science. So to start today's conversation, Dr. Gale, could you address the impact of the virus on marginalized communities?
Yeah, great, thanks. Can you hear me fine? All right, thanks. I'm in a different location than usual, so just want to make sure everything was working. And it's really wonderful to see your community that I know you rely on so much for the work that you do in St. Louis, and I'm just honored to be with everybody today. And so, as you mentioned, I've been involved a lot recently with the health side of the pandemic. My background is as a public health physician. I thought I had left that behind as I went into the work of the Community Foundation, where we're really focused a lot more on the economic impact of COVID. But it's hard for this intersecting crisis to not be involved in both the health public health side, which has created an economic crisis. And as your question referred to, we know that here in the United States, as well as around the world, this pandemic has had its greatest impact on people who entered into it, if you will, already vulnerable and fragile. And here in this country, we've seen that it has really had the greatest impact on communities of color. And no matter what, how you slice the data, whether it's among the elderly, whether it's around essential workers, healthcare workers, et cetera, it has borne its greatest brunt and had its greatest toll on Black and Brown communities. And one of the things that, that we addressed as we looked at creating this vaccine framework was, how do we actually do it with a lens of equity, given the impact that it has had so disproportionately on communities of color. And what we tried to do was attack the vulnerabilities, the reasons why people of color are at risk. It's not a biologic issue. It is clearly the impact that our society has had on communities of color who, because of their jobs, where they live, their family compositions, et cetera, has put them at greatest risk. So, all of what we tried to do was to really look at that from an equity lens and make sure that when vaccines and other treatments and other things are available for this pandemic, that they go to the people who have had the greatest impact throughout, both from a health standpoint as well as an economic standpoint.
Thank you. Bethany Johnson-Javois, I know that you've seen all of this play out on an extraordinarily local level. Can you paint a picture for us of what it looks like in St. Louis now?
Sure. Good morning to everyone. Grateful for the Community Foundation for inviting me, and to my colleagues, to Bob, to Kiana. And, this is going to be fun this morning. So I'm going to speak about it in 3 different ways. The pandemic has affected me as a person and the caretaker. It looks like this is the 3 words I want to use for all 3 ways that I enter into this space: pivot, partner, and deploy. My family had to pivot. We had to pivot. Hospitalizations were unfortunately part of what I too had to manage. And so managing that in real time while also thinking about the system was my personal experience, of which things like, for example, the impact of the virus called upon nonprofits and integrated health networks specifically as an intermediary to really think about how we were going to pivot and redeploy staff, redeploy thinking, and redeploy our infrastructure in a shared mechanism with other partners in the region, like the Regional Health Commission and Alive and Well and others. You get really creative and you start blurring the lines of who is doing what, so you can really do work that's high impact. Some specific types of community needs I'll share. Addressing grief, thinking about violence as unmetabolized grief, and anger as unmetabolized grief. Job insecurity, housing destabilization, especially around rental, mortgage, and utility assistance. Many of our community members were truly homebound, and not just the seniors. Cell phone plans failed people. Access to digital technology, even if you had a little bit of bandwidth, the ability as schools began to require that bandwidth, and Zoom was as we all know, was the rage. That's even just a different mental model of how to gather together, families being impacted and more. And then in the summer, as George Floyd and that incident happened, and we were all so exposed to that, again, we pivoted. And so pandemic, to be honest, connecting with community members to have true value and voice and trusted, we couldn't just talk about the coronavirus. We had to acknowledge the pain coming from the pandemic of historical racism structurally and what that meant. And for many people that I serve, the pandemic is the icing on top of structures that were intentionally designed to not serve well and equitably. I'll stop with that, and I'll populate the chat with more info.
Bethany, to follow up though, the vaccine, tell me how you see the vaccine and vaccine distribution.
Oh, you went right there, Ellen. Okay. So organizations like my own leaned in very heavily And honestly, there's a tension. There's a tension that I know that I feel from conventional institutions and leaders who would love to leverage the trust and the respect and the cachet of Black-led organizations and Black people to say, hey, use your voice to say that the vaccine is great and persuade your people to take it, okay? There's a pressure to do that. But as I listen, as we collectively listen to what community is saying, trust me to know that I make great decisions when I have information that is accurate, that is truthful, that is informed. So don't tell me what to do, but offer me information and experts that are trusted that I can take in information, and then I want the power to choose. And when I have the power to choose, I choose well. So that really is the approach that we're taking, not only to vaccine, but to all things, is the power of choice. So Ellen, in short, the approach to the vaccine is there are a lot of people that are not just Black and brown that are waiting and see. And there is information that I think all people need to get in order to make informed choice. That's more than just the headlines that we're seeing. People need to hear more in order to be persuaded in either direction.
Yeah. Do you mind if I a comment there? And thanks so much for that, Bethany. The very next thing that I'm going to after this is I'm co-chairing a panel that the National Academies is doing around the whole issue of vaccine confidence. And this has become such a huge issue, you know, because we know that there are at least 3 different categories of people who don't, of groups who kind of don't mistrust this vaccine, and you know, for good reasons, and particularly when we think about, and there's a question on the chat about the whole issue of the Tuskegee experiment, and we often hearken back to Tuskegee, and I actually think, you know, very few people alive today even really know what Tuskegee is. It is emblematic of an issue that has continued. It didn't stop with Tuskegee. It is emblematic of a system that has been biased, discriminatory, and has mistreated people of color. And so that continues on. And there, you know, for all the reasons that Bethany mentioned, there is really good reason for people to have skepticism around this vaccine. And I think a lot of people have approached it from the standpoint of, yes, let's use our trusted messengers to coerce people into taking this vaccine. And I think unless we do exactly like you mentioned, give people the information, trust that they make good choices about their lives, and you know, make sure that we're partners on that journey, as opposed to a medical establishment saying, we know what's good for you, take this. So I just want to say, you know, you encapsulated exactly what I think we've often missed when we think about how we build trust and trustworthiness, if you will, with communities who have a history that makes trust having been breached too many times.
All of this underscores, I think, what Kiana Thompson has been doing in Kansas City, where she has led the Health Foundation in Kansas City to focus entirely on equity. Kiana, can you explain to us, mostly in St. Louis, why supporting equity is critical, and how is that different from the way the foundation has operated in the past?
Sure, thank you, Ellen. Good morning, everyone. I want to thank the St. Louis Community Foundation and my peers for the opportunity to share virtual space with you all. Health Forward Foundation has been around for 17 years in Kansas City. We are a health conversion foundation, and we are quite broadly situated in our funding today. Prior to my arrival, which was in January of this year, the board sanctioned an ad hoc equity committee because we wanted to really deepen our roots and go beyond representation in the realm of equity. And when I say that from a representation standpoint, 54% of our board of directors are people of color, and nearly 50% of our staff are people of color. but we know representation is just the foundational element to equity, and there's so much more to it. I just happened to be an equity practitioner, and that the Health Foundation was looking for, and so we had an ethos and a DNA match. Since coming on, we have elected to go further upstream and address racism as a public health crisis, because that is exactly what is occurring for people of color in our community. Many may be familiar with the term social determinants of health. I prefer to say social influences of health. For Black and Brown people, racism is our primary determinant or influencer of health. Because we live and swim and breathe in systems that have been systematically designed to advance white people while oppressing Black people. So the essence of racism. So our mission is to provide leadership, advocacy, and resources that do two things: eliminate barriers to health and promote quality health among the uninsured and the underserved in our service area. When you step back and you look at the shared experience of who we serve, that is poverty. And what underpins poverty are a few things: structural racism and income and wealth inequality. And so in an acknowledgement of that reality, it's important for us as funders to think about how we are uniquely positioned to drive meaningful change in health. And that is a pivot in thinking away from aid and charity, kind of focusing on the symptoms of structural racism and the symptoms of inequality, and going further upstream and addressing these root cause factors. So we are focusing on that, and we know that we can't achieve our mission without focusing on health equity, and you can't focus on health equity without focusing on race equity, the condition in which one's racial identity has no bearing on their ability to thrive and self-actualize. And Bethany was talking about the concept of choice. It's all about having access to power, money, and resources at the end of the day, right? So that we can be self-determined to make good choices and to make the choices that promote health and well-being. But we don't do that in a vacuum. We do that also by addressing, as a community, the systems, the policies, the structures that are not conducive to health. And so as we think about that, we have to realize that in every election, at every city council meeting, at every city planning and zoning meeting, there is a health and race implication in every policy that we consider. And so we are both focusing on that micro level as well as that macro level, both people, place, and policies, knowing that we need to be able to shift power in our community.
That goes exactly to what Bob Hughes was saying when we were preparing for this program. And this is a direct quote. Bob said, "There's no place where equity should not be on the table." So Bob, my question to you is, what does that look like statewide in Missouri?
Well, good morning, everyone, and good morning, Ellen. Thanks for the question. How much time do we have? Let me also thank Amelia and colleagues at the Community Foundation. It's a privilege to be part of this panel and to be talking with this great group of folks who are on the screen. You know, Missouri is a varied place, and we're a foundation that, you know, our service area, we're a conversion foundation like Kiana's Health Forward Foundation. Our service area is formed by the old Blue Cross of Missouri. So we cover about 3/4 of the state of Missouri. So, and Missouri is quite different in different parts of the state. You know, that's not news to anyone, but when we think about health, and sort of picking up on Kiana's appropriate focus on, you know, social determinants, social influences, underlying determinants. Though that's where we at the Missouri Foundation for Health really focus. We aim to, in the long run, really eliminate the underlying causes of health inequities. But that looks very different in different parts of the state. And so one of the things that that we have to do is listen and learn, establish relationships, get to know the various communities across the state, and then look for opportunities to make an impact on the systems that Kiana and Helene and Bethany have been describing, so that we can make real changes in those systems. And let me just give a couple of examples. You know, the recent passage of Medicaid expansion offers a real opportunity across Missouri. And that will address a lot of inequities across Missouri in terms of people who don't have access to health insurance. And we think of that as a cross-cutting issue across the state that will have great effect in rural communities, certainly in urban communities, but also, and this is something I think people often are not aware of, the largest proportion, the largest number of people without health insurance actually live in suburbs. So that's the kind of system change at a state level, which is why we're working with a number of partners, including Kiana and her colleagues and Bethany, on focusing on the successful implementation of expansion. You know, expansion just doesn't happen automatically. There's a lot of work to be done to make sure that it is as effective as possible. A different example that kind of illustrates more how different things are in different parts of the state is work that we're doing on reducing and preventing firearm violence. Firearm violence looks very different in different communities. In some communities, it's literally different kinds of firearms. So it's more handguns and interpersonal violence or accidental shooting in urban areas. In rural areas, it's actually more long guns and the largest proportion of firearm violence in rural areas is really suicide, and which is in some ways a reflection of the real pain that occurs in rural Missouri as a result of some of the economic shifts that have been going on for the last couple of decades. So there's a lot to be done. You know, with the pandemic, I think, as Helene has nicely described, both revealed and intensified the pre-existing inequities in health across Missouri. And that's what we're dealing with. So we're trying to deal both with the pandemic as well as and build on the work that we're already doing to change the systems that are really leading to these poor health outcomes.
It seems to me that if indeed we see philanthropy as an agent of change, it begs the question of whether it's time to change philanthropy. And again, quoting Bob in our preliminary discussions, Bob said, making grants is easy, being thoughtful is hard. So I guess I'd like to ask each of you, starting with Dr. Gale, to explain how your grant making has changed. We know that participatory philanthropy is a phrase that's thrown around. Can you make it come alive to us and explain what it means to you, Dr. Gale?
Sure, thanks. And I guess I would say You know, the way we've looked at it is not just how has our grant making changed, but how have we changed as an organization? You know, grant making is part of what we can do as a foundation, but there's a lot of other ways that we can use our organization to be, you know, as we've said, moving from grant makers to change makers. And, you know, I think that first of all means being willing to take a stand on issues. You know, we're a nonpartisan, you know, organization. We don't take political stances, but, you know, we did develop a strategy about a year ago that said that we would really prioritize closing the racial and ethnic wealth gap as our highest priority because it undergirded so many other issues. It was, you know, underneath all the other issues we face, whether it's gun violence, poor health, lack of access to quality education, et cetera, that if we could work on ways in which we could build assets both within families as well as communities in the Black and Latinx communities in Chicago, which make up 2/3 of our population, we would not only be doing something that made a difference for the populations who have been systemically and systematically left out, but we would also have a huge impact on the region's economy. You can't hold 2/3 of your population back and expect that the rest of it is going to move forward. So we as a community foundation felt this was, you know, our highest priority. So we've taken a stance on that as our issue. And that has basically helped to organize the way we do all of our work. It is what we put our discretionary grant making towards. It is what we work with our donors within our base to see if they would be interested in engaging on a journey with us. We have added a policy and advocacy unit because we, you know, as a community foundation have the ability to actually advocate. And so we use our voice, we use our influence. And, you know, we really look at how can we be a platform for change for the whole community? How can we help to convene and bring people together on this journey? So as a city and as a region, we're all kind of rowing in the same direction about this issue that is so critical. So, you know, I see what we're trying to do is to not just look at how we do our grants differently, which we are, because we're thinking about our grant making in a way that engages the community more, brings in other ideas, have a real dialogue with communities so that we're thinking about what their needs are. We're doing a lot more to lift up the voice of community, work with community organizers, really develop a whole new way of working when we think about our grant making. But in addition, it's also shifted how we work as an organization overall, you know, really trying to move forward in a way that gets beyond just thinking about grants, but thinking about how do we create change.
Bob, you have some examples of participatory grant making that the Missouri Foundation for Health has been practicing for a while now, right?
Yes. You know, I so enjoy hearing you, Dr. Gale, talk about your perspective. It's funny, we use the same phrase from, you know, grant maker to change maker. You know, you so nicely sort of capture our thinking. I hope we're recording this. Maybe I'll borrow it and you know, use it. You know, we're focusing on what it is we're trying to do. What is the change we're trying to make? And then asking ourselves, what are the best tools that we have, and what are the, you know, to influence that change and make that change happen. And some problems really require and will benefit from and you know, working with the organizations that are delivering the services. And that can be pretty well laid out and implemented. Other changes really require deep community involvement from the get-go, including even what's the problem that we're addressing. We took on the focus 2013 to reduce infant mortality in St. Louis and the Boot Heel region, because that's where the problem was the worst. And it was also, not coincidentally, where the racial gaps were the greatest, where Black babies were 2 or 3 times more likely to die than white babies. And we had to work, I'd say it took 3 to 4 years to establish relationships with community groups, with community members, in order to both understand their perspectives and their values and their ideas of what needed to be done, to begin to help to set up some structures so that their power could be exercised over the resources that we have. And 7, 8 years later, we're now to the point where all of that work is now essentially done in the community, not by the foundation. The infrastructure is there. The processes have been set up by the community, for the community. The decision-making is made by the community. That we've learned a lot as we've gone through that process. It's not, it requires a great deal of both humility and discipline and honesty and tough conversations. But we've learned from that, and we've had the great opportunity. Partnership is sort of in our DNA, in conjunction with the Deaconess Foundation and Robert Wood Johnson Foundation, and now the St. Louis Community Foundation and many others. The St. Louis region has a racial healing fund, and that racial healing fund is being administered by Forward Through Ferguson, which was formed out of the Ferguson Commission, that Bethany and many others on this call were so instrumental in effectively sort of doing just wonderful work for this region. And Forward Through Ferguson is using some of those same techniques and lessons that have been brought over from our reducing infant mortality work. And that work is now going on, and and with the same kind of values, the same kind of approaches. And we think that's, that we're very proud to be partners with community members and other organizations and other funders to support that work.
Bethany, on the chat, you talk about an inside-out strategy. Can you speak to that, and also talk about how participatory philanthropy looks like at the grassroots level?
Ellen, ask me once more. I want to make sure I respond succinctly.
Okay. So you talk about an inside-out strategy.
Yeah.
Can you address that more fully?
Sure, I'd love to. So when I started talking earlier, I told you the way that I had to pivot as an individual because of my ecosystem. And then for those of you that are funders individually or collectively, nonprofit, we also had to pivot. And what it looked like for my organization, for example, is in this inside out strategy. We said, hey, before we can start, meeting the needs of others, we need to figure out what our infrastructure will be to care for those that work for the IHN. So we immediately sent out an email. We didn't make a blanket lovely statement. We just said, hey, in the power of choice, and we know that a lot is happening right now for you internally, what kind of support can we give? Do we need to increase our ability to do racial caucusing? Would you like more one-on-one time with your individual boss, right, or leader? Do you want to form organizationally in a different way that we haven't even suggested because we don't know? Choice, right? Because we needed to care for those who are doing the hard work. And in that, they said, thank you for acknowledging that we are hurting. Thank you for having conversation with us. And here are the choices that we would like to take. Some opted out, some leaned in heavy. That also helped me as a leader to understand how much pain I needed to account for and support institutionally, before I could even go external to some of the things that we're listing that we're doing. So my point in saying inside out strategy is, it is very easy to think about our power external to ourselves. It is much more difficult, but this environment that is lasting, there is no such thing as the new normal. There's no such thing as back to normal, actually. It's just a different environment. To really think about the ways with which we are accountable to those that we serve and lead, to hear that pain, to pivot fast, which also informs our external strategy. But if we're not clear internally, this work, especially around racial justice and racial equity work, which is essential to overall health equity, you miss a point. And the last thing that I'll say about this is this word power. Bob used the word. I think we're all starting to get comfortable with that. And I think that a real fundamental conversation we need to have is about power as related to philanthropy. On my side of experiencing as a nonprofit, there's a lot of power exuded over us. The way with which we can and can't operate, the ways with which we can even enter into a process to apply, the explanation that we have to give. There's something about the way that philanthropy is structured that no matter the intent to want to understand, there's some barrier somewhere in the power dynamic that still feels like a secondary third party asking questions that perhaps are about 2 levels away from what's happening on the ground. I'm not saying that as an indictment. I'm saying that as an opportunity for us to think differently about power and how philanthropy thinks of itself and communities that it funds.
So help me understand what that really looks like. I mean, how can that change occur? Can you give me an example of what feels right and what doesn't?
I'm happy to take that.
Yeah.
Yeah. So I like the fact that we're centering in on power because philanthropy is really a microcosm of the capital structures that are in America. Okay, they're centered around power. And so philanthropy is a microcosm of that. So what we've been really exploring within Health Forward is the concept of philanthropic justice. Okay. So we know that people of color, especially Native and Black Americans, were significant contributors to wealth generation in our country, okay? So America got wealthy on the backs of Black Americans. Yet, when we look today at these power structures and access to capital, we don't see Black Americans and other people of color with the same levels of access to that capital. In philanthropy, less than 4% of philanthropic funds are going to organizations led by people of color. And Health Forward would like to participate in changing that dynamic. So we're currently undergoing a comprehensive equity assessment. Bethany talked about the importance of kind of beginning with the inside, starting with inside out. Because of the climate that we're in, we're having to do both at the same time. We're having to evolve and change as well as respond to the needs because it's time to act, right? We can't sit by and say, we're gonna take this 3-year equity journey and learn and discover while our community's on fire, right? So we have to do both at the same time. So we're undergoing this assessment. We just looked at 2019 data. Which is the first time that we had looked at our data through a racial lens and from the perspective of grant making, excuse me. And we learned that 18% of our 2019 grant making went to organizations led by people of color, okay? We grant make $20 million a year, so that's about $3.6 million. When you think about the proximity to the issues that need to be solved in our communities. We know that organizations led by people of color and who have an agenda and a mission focused on those communities are proximate to the problem, okay? As Bethany talked about, they possess the competency, the expertise, the lived experience to know how to solve these issues. So we need to ensure that we can facilitate access to capital and help them sustain access to capital by organizations led by and serving people of color. So that is something that we are prioritizing and help forward from a grant making perspective. One thing that's not talked about enough in philanthropy are our assets under management, right? And who is managing those assets, okay? So you don't see diverse firms in philanthropy really having a seat at the table, okay? So that's another area that philanthropy needs to reckon with, is ensuring that we have diverse funds that are managing our assets as well. So we are looking at this from the inside out, but also looking at the policies in the community that are creating inequity. So you have to do both at the same time.
Bethany, does that put an extra burden on organizations like yours?
It's a relief. It's a relief for organizations, and I'm not tooting my own horn, but I want you to know St. Louis did something very creative that works. St. Louis and our community health centers decided to pool resources they didn't have, take $25,000 away from their direct operational funds to create a health intermediary called the Integrated Health Network more than 15 years ago. It took 10 years, and trust me, I was there for them, to try to create infrastructure enough that when this moment came, we would have enough infrastructure to be able to respond and deploy. And so it took individuals to really think collectively about not the short term, what am I taking out of my pocket, but the future vision of what does this region actually need more than just what I can give in direct service to really help to buoy this infrastructure need. And so when I hear Kiana talk, when we think about the benefits of MFH that have seeded so many things that are now allowing us to have more collective infrastructure, not just separate programs, not just smaller impacts. In this moment, we were able to say, when the Community Foundation reached out to say, hey, what do you need? We were able to say succinctly, we need these 3 things to do these 4 things well, and we need the money now, and we'll give you outcomes. And we were able to pivot. So there is a long-term game. And my appeal to this audience is, I know that we have projects, things, and passions that compel us to act, and that is the starting point. However, the way with which we build, wield, yield power together, thank you, Cheryl, in the chat, is so important that we do it truly collectively. And that means not siphoning off, because when we talk about power, there's a choice to make here. A power to siphon off the collective vision. Are we going to have diffuse light, or are we going to have laser light? And this is the moment that we're determining that. And I'm grateful for the vision of Betty Jean Kerr and the vision of Rob Friend and the vision of so many that allows us to be able to act in this moment. But it took from 2002 to this moment to build that infrastructure for today.
Could I just add, you know, one of the things that, and I work for a large national foundation, global foundation, Gates Foundation. I've been on the board of a couple of national foundations and now serve at a community foundation. There is one thing that I have said is consistent about philanthropy, which is that it is a arrogant endeavor. You sit as judge and jury. And, you know, I think this issue, and, you know, I love philanthropy and I think philanthropy does great things. So this is not a knock on philanthropy, but there is something about sitting as judge and jury that seeps into the culture. And unless you are actively thinking about how you change your internal culture, all of the things that we've talked about aren't going to happen. And so, you know, we have deliberately gone on a journey as a staff about how we think about ourselves in relationship to the communities that we serve. We have gone on a journey with our board because, you know, if your board isn't also thinking about how you center on racial equity and how you really think about power and power dynamics differently, you know, it will make it difficult because the board and staff operate as one organization. So I think, all the things we're talking about also means that internally foundations need to think about how they view their own power and the power dynamics. And although, it is impossible to escape the fact that there will always be power dynamics when you're the one giving out money, and when you are making decisions about who gets money, that there will always be that. But I think if you're not intentional about how you handle those power dynamics and think about ways in which you shift them, will continue to perpetuate it. And I would just say, there's been an incredible amount of work recently and great articles about this whole notion of philanthropic apartheid, philanthropic, racism. And I think we need to be thinking about how we bring our own preconceived notions into this, and how we continue to go on that journey so that our mindsets are shifting as well.
At the risk of appearing to be an incredible cheerleader, Amelia and/or Neosha, do you want to address what the St. Louis Community Foundation is also doing internally as well as externally?
Absolutely. I was frantically writing notes here for my closing comments to really answer that exact question, Ellen. And thanks, Helene, for teeing that up, because this is exactly where the St. Louis Community Foundation is doing a lot of internal work. We just completed an assessment that Forward Through Ferguson did for us of we surveyed staff and board, and it gives us a roadmap of the work we have to do internally, and constantly we are challenging ourselves to say, we need to be intentional, we need to be thoughtful. This is a work that the St. Louis Community Foundation needs to embrace, and to not only just understand ourselves, but bring the community into this work. And if we can't do it ourselves, then how can we expect the community? So our grant making is increasingly intentional. We have an equity lens we are working very hard to bring an equity lens to everything we do. We have much work to do, but it's a journey.
Neosha, I know that when we were preparing for this, and Bethany made the point of communications and how difficult it is to ask the recipients of our grants to communicate because of an infrastructure issue. You deal with that all the time. And I know the foundation has tried to support many efforts in St. Louis. Can you talk about that just a bit?
Sure. So as Amelia just discussed, we have been really working towards equity internally, and a lot of the communication for the foundation and with our rebrand was definitely situated around how can we uplift what's going on in community? How can we uplift what's going on in St. Louis, but also the work that's actually being done by some of these great institutions. And it is a challenge on the communication front to be very intentional and respectful of the stories that we're sharing, and the stories and how we're actually commenting, but also actually telling stories in a way to get people to understand that there are things that need to happen in community to seek change. And so I think from a communications and marketing standpoint, we really try hard at the foundation to uplift and to put people at the forefront who oftentimes may not be. But I think it's also something that we are definitely a work in progress and trying to figure out as we continue down this path to equity.
Bethany, it's an issue that you brought up. The need for the stories and the difficulty in telling them. Can you address that?
So when we think about power and when we think about advantage, the person who holds the narrative holds the power. And when we're talking about equity, We're talking about an intentional way with which we look at the most in need, and we deploy resource and support to those most in need. It's just interesting to me as I look back, right, at how power moves and structures move, that there are organizations that have much more resource and have a whole wing of marketing and communications and strategy people who are able to write a 6 or 7 figure check to a firm that we all know and love and everyone uses. But as we're doing work on the ground, trying to create a different message and another narrative, we don't have a Marcom office and institution. We don't have a wing where we can write a check. We don't have a way with which to really take communication to a different level. And I'm not talking talking points. We're talking about relationships, right, that can help us to really create the narrative enough to change it, right? And so as long as systemically, institutionally, we are asked to, as nonprofit, do the work, do it cheap, scrutinize for how much we spend on laptops, scrutinize on what we call indirect and what isn't, scrutinize on the approach and how we spend our dollars to the dime, while also saying you must also communicate and represent your entire community. There's a lot of power in that, and there's a lot of oppression in that. And so my point about communication is not thinking of it as talking points and websites only. Those are mechanisms, but a true reframe of a mental model that has to shift. And to get that level of work done, to get that level of behavior change done, that's just a different way of thinking that we don't have the collective way to get that done together. I'm not suggesting 100 nonprofits should have their own communications firm. I am suggesting that that is an area of philanthropy that hasn't been tapped, as well as this area of how do we really aggregate so that we can have collective voice together in this space to counter the meta narrative that is out there.
And Ellen, on that really briefly, what Bethany's mentioned is really powerful in terms of narrative change. I think nonprofit, very well intentioned, has deficit framed the populations we serve that are largely Black and brown. Okay, even our mission, which we plan to reframe as we go through our strategic planning process next year, talks about the uninsured and the underserved. Whenever you have a narrative that first speaks about people by who they're not and what they lack and what their issues are and what their problems are, we will always see them through that narrative as less than, as inferior. We must first start by speaking about who we serve and who we are, because I'm a product of who we serve. I was a product of investment in human capital. I was a product of the Kansas City Safety Net. I did not want to be called this and that, okay? So we first must talk about people by their assets and their contributions, then describe their need versus labeling them. So it's really a shift from deficit-based framing to asset-based framing. And I think this is something that our entire nonprofit community really needs to grapple with and develop as a new competency. And it's one thing that we're working on and funding at Health Forward. We're partnering with the National Convergence Partnership and in a power building, power shifting construct, we are funding narrative change so that communities can determine, self-determine how they want to be referenced. What are our attributes, our strengths, our assets, our qualities, our successes? Let's frame our narrative first for our policymakers and then talk about our needs. So we're funding that work that's coming from community, as well as thinking ourselves about how we need to begin to change and talk about who we serve differently.
Kiana, I noticed that you said communities, because I think we are not talking about a monolith when we talk about equity. Can you describe how you deal with many different communities on both sides.
Say that question again, please. We're not.
So you talk about communities. I think, you know, it would be nice, maybe, or easier if there was one group of people who had one vision and acted in one way, and we could address that problem. It's not that simple, is it?
No, it's not that simple, especially for a foundation like Health Forward. We serve a bi-state community where both urban and rural communities are in our service area. We serve Black, brown, and white. So I think to address the issue of speaking or acting or funding as if communities are a monolith, you have to get proximate to the problem, first of all. And you have to share the power, like we've talked about, and let the community define itself for you and tell you what it needs. And so that means that you have to have more of an engaged process. You talked about participatory grant making. It's beyond grant making. It's really about engagement with community and getting proximate and hearing from them in terms of their needs and allowing that to drive what we focus on and what we fund and what we advocate for in the policy space. So we are doing that body of work right now that's focusing a lot on really asset mapping in the community as we prepare for our strategic planning and hearing from the communities about their assets first.
Bob, you had...
Oh, sorry, I was gonna make a comment earlier after Bethany, but it follows nicely on what Kiana was saying. You know, this whole issue of shifting the narrative is something we've put a big focus on. And one of our strands of our strategy is called Building Collective Power. And one of the initiatives within that is a real focus on funding kind of neighborhood-based, hyper-local media and journalism, because we know that the stories that people tell from communities, from their perspective, is very different. And I, think of a really tangible example of how a story was told in our mainstream press about a gathering that occurred with some young African-American adults that was a real shaming. It was, what's wrong with these people in the middle of COVID doing this? The media that was community-based told the story of a group of young people who had suffered loss of one of their friends to COVID and how they put together something to memorialize and remember. Did they make some choices from a public health standpoint that were not wise? Yes. But it humanized this from a group of young people that are acting randomly to a group of people who care about a friend and built on an urge that we all have. And I think, it's just an example of how differently stories get framed when they're framed from the voices of the community and really take into consideration people's humanity in a different way. And so, this is something we're going big on. We believe that this whole issue of narrative shift is critical to how we attack these issues. And unless we're giving voice to the many neighborhoods, because they are distinctive and they do have their own issues, we're not going to tackle this appropriately.
Bob, I know that the Missouri Foundation for Health was concerned with the coverage of health in general and worked with Kaiser. Can you talk about that a little bit?
Oh, when you say coverage, you meant news coverage.
Right. That's what right, yes.
For some reason, health insurance came to mind.
Sorry, I apologize for that being clear.
Yeah, one of the things that I think we recognized in Missouri is that how much as the media industry changed and there was a loss of a lot of local journalism. A lot of the health news really was emanating primarily from the coasts, and that influences a lot of the narratives. And So we were fortunate to be able to partner with Kaiser Health News, which is a respected, very respected news organization, and work with them to establish a Midwest Health Bureau here in St. Louis, with the intent of identifying and communicating stories that reflect the Midwest and the issues that we're dealing with. And that we think is a really important sort of infrastructure contribution. It's the same reason we support St. Louis Public Radio and their work. It's crucially important. The narrative is, you know, we have such sensitivity to language and to the underlying themes that are embedded in the way we talk about things, that, and in some ways, much of that triggers reactions that end up being counterproductive in terms of our collective health. That we really need to think about how do we make progress on that, and that can be around particular issues. We've actually invested not only, you know, with Kaiser Health News, but also with an organization called Frameworks around both what is the narrative around firearms in various communities, and what are attitudes around firearms, and how can we communicate more effectively so we can begin to have good conversations to work on this issue. We're also doing the same with regards to public health. You know, public health, I mean, one of the real revelations, I think, for many in the country is just how inadequate our public health system is. And that's certainly true here in Missouri. It's just, it's really unfortunate. But we're also doing that with regard to the vaccine. We're talking with community members. We're gathering small groups to understand their attitudes, their concerns, their questions, what they want to know about the vaccine, and then trying to coordinate communications activities. And we're doing this, you know, with Health Forward, with the state, and with public health across Missouri, in order to begin to more effectively answer the kinds of concerns and questions that people have across Missouri.
We have tried in not very much time to cover a subject about which there are books written and more books to be written. We really appreciate the panelists, their candor and their articulateness. But like all good things, right now this needs to come to an end. So it's my honor to turn it over to Amelia.
Thank you, Ellen. Well, first, I want to thank our esteemed panel. Wow. It was just a pleasure to listen to all of you, and just gives us so much to think about. I also want to thank all of you for joining us today. I hope you enjoyed this robust conversation. I hope you've obtained some information about what is taking place, the hard work that's being done. Bethany shared so many valuable examples of the need, and you know, the enormity of we need to stay focused, and this needs to be on the forefront of our thoughts and actions. I want to mention that we've developed an evaluation survey, and we will want to encourage you to please take a moment to fill it out. It will be provided in the chat, and we will also be emailing it to all of you who listened in today. The survey is intended to provide you with some opportunities to request information. For example, we have some additional reading to suggest. We have a list of nonprofits in the St. Louis region that are engaged in health equity work. We also have a list of national philanthropic organizations on research and writing on equity. And then last but not least, we want to gauge your interest and the we are considering the establishment of a giving circle that focuses on issues with regard to equity. So with that, again, the survey will be posted as well as emailed. I want to thank you for your time today. We encourage you to utilize us at the St. Louis Community Foundation as a philanthropic resource. Please connect with us at any time. We have a phenomenal staff that's worked very hard to pull this event today together, and all of us want to be your resource. And I want to wish you all a joyous new year as we finally leave 2020 behind us. Stay well. Thank you to the panelists. Have a wonderful day.